So I'm gonna go ahead and get started. My name is Joy Harris. I'm the Director of Education Services here at PHAB. I've been at PHAB about 2 years, and I'm coming to you from Iowa. Um, and excited to talk to you today about pathways. I'm joined by Amanda Marino. I'm going to have her introduce herself to you all. She's going to help us with the chat. Any questions? So Amanda, do you want to introduce yourself?
Yeah, thanks, Joy. Hi, everyone. My name is Amanda Marino. I am the education specialist here at PHAB. I have been here just over a year, and I'm coming to you from New Jersey. Thank you so much for joining us today, and I will keep an eye on that chat for any questions. Handing it back to Joy.
Awesome. So logistics wise, you will get a recording of this webinar and you'll get the slides by the end of the week. So that'll come directly to your inbox. We are people are muted, so we'll need you to ask questions, and we hope you will ask questions using the chat, and we'll be watching that. And then on my next slide, I just want to make you aware that if you need to turn on closed captioning, that's available for you. So please go ahead and turn that on. We are recording today's training so that we can send it out to folks. All right, let's begin. So Pathways was announced by PHAB in July of 2022. And so it's relatively new and pretty recent. It was really started as a way to address the needs of smaller health departments who maybe weren't as ready for full accreditation, but wanted to take those formal steps towards quality improvement. We are excited to tell you that we have our first department, Pathways Recognized. So this is a excerpt from the press release that went out in August about Siskiyou County. I'm hoping that you can hear from them all one day about their experience. But just wanted to say all of that so you know that we're new and we're just getting started with Pathways. We're moving along, so that's really exciting. I wanted to talk about why Pathways was developed a little bit more. So first, accreditation is an exercise in performance improvement. So really embracing those opportunities for improvement, understanding that you don't have to do things the way that you've always done them. And with Pathways, the thought was that it would be a formal step. So you would engage with PHAB, you would have that site visitor, site review perspective, a peer perspective on your ability to meet the standards and measures. And it would be a step towards formalizing that work towards performance improvement, and if folks wanted accreditation. We recognize that not everyone is going to be able to apply for accreditation. However, with Pathways, we wanted to be sure that we were taking advantage of the Pathways program for folks who did want to move on to initial accreditation. So we offer a couple incentives related to Pathways if you want to move forward to initial accreditation. So first, any measures in Pathways that are scored as largely demonstrated or fully demonstrated move forward to accreditation. So you don't have to resubmit those documents again. Those scores just get carried over. And then also you'll get a discount on future accreditation fees if you move forward within 2 years. And we'll talk about that more. So that was why, and really some of the incentives that we put around Pathways. I feel like there's a few more as we go through the slides that we can talk about. One of the things that I hear most that I want to clear up right away is that the Pathways standards and measures are somehow different from the standards and measures for initial accreditation. That's just not true at all. So what this is meant to show you is for local health departments, there's 76 measures that are part of initial accreditation. Those first 34 are related to the foundational capabilities, and those first 34 are exactly mirrored in Pathways. So the 34 measures in Pathways are exactly the same as 34 measures in initial accreditation. So there's no difference between the two. It really is meant to be kind of that pathway to formal accreditation. And so we wouldn't want to make them different, right? We want to keep them the same emphasizing that role in the foundational capabilities. Cover of the standards and measures for pathways recognition. This is what we're going to be talking about as we go through. This is the first version of pathways, so version 2022. You can see it was adopted in February of 2022. Our standards and measures are based on a couple of things. For pathways, I really want to focus on the foundational public health services model. So the foundational public health services model is meant to describe the governmental public health system and the role of the governmental public health system. There's those foundational areas across the top: communicable disease control, chronic disease and injury prevention, environmental public health. Those are provided differently in every jurisdiction, really based on the needs of the jurisdiction, resources of those jurisdiction. And so while you can use documentation from these areas in pathways, there aren't measures specifically about these foundational areas. The measures themselves come from the foundational capabilities. So those blue rectangles, right? Assessment and surveillance, community partnership development. The foundational capabilities are really those building blocks that you have to have in place in order to be able to provide those specific services and have a population health, public health infrastructure for your jurisdiction. I also want you to note that equity is a part of this model and part of all those foundational capabilities. So from the foundational public health services and with the foundational capabilities, pathways really gets to how departments perform in these areas. I also want to make sure that you understand that our standards and measures also come from the 10 essential public health services. This has recently been revised. You can see that the core public health functions are the same, right? Assessment, policy development, assurance around the outside. But the model looks a little bit different, and the 10th essential service is new. Now it's build and maintain a strong organizational infrastructure for public health. So that really gets to things that are part of the foundational capabilities, like strategic planning, like quality improvement, like information management infrastructure. So the 10 essential services are our 10 different domains of the standards and measures, and those 10 domains are all part of the Pathways program. Here are meant to also help you understand that our standards and measures come from the field. So feedback from the public health field. As we develop new versions of the standards and measures, we put those out for public vetting, for people to ask us questions, provide suggestions, potential rewording. Version 2022 was reviewed prior to my time at PHAB, but I understand that we received thousands of comments on version 2022 that we worked through. And so we're always appreciative of that input. And our standards and measures have built on previous standards and measures who all use that process of going through the field for public vetting. So that's where the standards and measures come from. And I know that's great, but if you haven't had a chance to look at the standards and measures, I really thought maybe we could spend time on what does that really mean. So I picked a foundational capability measure from each of the domains to give you an idea of the kinds of things that are included in pathways. So from domain 1, participating in data sharing with other entities, right? It really looks at how you share your data to advance population health. From domain 2, ensuring continuity of operations during a response. This really gets to what does that look like for you? What programs do you need to continue? What are the arrangements you have for people to work offsite or virtually? Next, from domain 3, implementing health communication strategies to encourage actions to promote health. How do you do this? What does it look like? How do you partner with the media? Those are all things that are part of domain 3. In domain 4, participating actively in community health coalitions. We do this in public health all the time, right? So involvement in those community health coalitions to address the needs of the population that you serve. From domain 5, the adoption of a community health improvement plan or a CHIP. What I hope you're seeing as you go through this is a lot of these things you do, right, already as practice. And so the standards and measures really get to, I think, what we already are doing in public health. For domain 6.14 is about conducting enforcement actions. And if for some reason a health department doesn't conduct enforcement actions, there's a way to provide PHAB with that information. In domain 7, collaboration with other sectors to improve access to social services. So really understanding where things are delivered in your jurisdiction, not that you have to do it yourself. In domain 8, providing professional and career development opportunities for all staff. With this one, it really gets to the importance of continuing to grow our public health workforce and increase their competency. Next, in domain 9, implementing quality improvement projects. We already talked about accreditation is an exercise in quality improvement. And so in this case, we're looking for documentation of the quality improvement projects that you've conducted. And then finally, from domain 10, oversee grants and contracts. We all do this all the time because there's lots of those that come in and really affect our work, our reporting, those kinds of things. So these are measures that relate to those foundational capabilities that are all part of pathways. So through the pathways process, you would be providing documentation that shows how you do these things. And we'll talk a little bit more about that as we go. I also want to be sure that we talk about where you can find the foundational capability measures and the standards and measures. So if you're looking at PHAB standards and measures for pathways, the only standards and measures you're going to see are the ones that are foundational capabilities for pathways. So they appear out of order, they're not numerical order, so don't let that throw you. If, however, you are looking at the initial accreditation, standards and measures, you can also tell from that version which are the foundational capability measures. And there's a couple different ways that you can do that. So on the cover sheet there of domain 9, you can see at the bottom the foundational capability measures are listed, so you know exactly which measures are foundational capability measures. And then we also mark on the first page of each measure that's a foundational capability measure with that rectangle. So you can clearly see that it is a foundational capability measure. So these are two ways that you can note that as you look through the initial accreditation standards and measures. We also have taken a look at where the foundational capabilities are throughout the document in this one pager that you could download from our website and really provides directions to where these measures are. So there are lots of different ways that you have to identify the foundational capability measures. For me, the easiest thing to do would be to download the pathways standards and measures, and that's going to give you everything that you need to know about those foundational capability measures. Ooh, and also on this slide, I want to point out, if you were to download the Foundational Public Health Services model, you're going to see that our measures don't exactly match the examples in that model. What we really try to do is match the spirit of the foundational capability, not necessarily each detail. So I hope that you'll be able to see that crosswalk, but just want to be sure to clarify that it's not an exact match. Okay, so I feel like we've kind of laid the foundation around pathways, where the standards and measures come from, and a little bit about those. So I want to talk next about the process. I use this picture here of just show building, right? Pathways recognition is a path to build the infrastructure of health departments. And so we really look at it that way and as an awesome opportunity for folks to take formal steps to really look at their department and think about ways that it could be improved. And also to know your strengths. Okay, so who is eligible? So local health departments, tribal health departments, US territories and freely associated states, military health departments actually are eligible for pathways. State health departments are not eligible for pathways. So I think that's really important to note. and it's a difference between Pathways and PHAB's other products. How much does it cost, right? That's always the big question. So cost-wise, the first part of Pathways is the readiness and training year. And in that year, you do a readiness assessment and you receive training from PHAB. That costs $1,299. Then if you do one track of Pathways, which we're going to talk about in a little bit, that's $3,050. If you do both tracks, $6,100. So we tried to keep it as affordable as we could, just to give hopefully more folks a chance to engage, but that is how much it costs. And then the incentive that we talked about early on. So if a department is recognized, so they complete both tracks of Pathways and they apply for accreditation within 2 years, they receive a $2,400 discount. If they do one track, or half of the Pathways standards and measures, they receive an $1,800 discount. So these are also incentives built into the process to hopefully make the bridge to initial accreditation a little bit easier. What this shows is that there's a time frame associated with that 2 years, and it really shows you that you have a lot of time, I feel like, to make a decision between doing Pathways and making a decision about initial accreditation while making sure that you keep all those incentives. So in this situation, we had a department go through one Pathways track. You can see the different steps that they took and the time frame there in pink. So it took them through the 4th month of year 2. They have all the way to the 4th month of year 4 to make a decision about applying for initial accreditation. So as you learn about your department, you have time to formalize things that maybe need to get formalized, work to develop things that you want to develop. And so that gives you a good amount of time to decide if you want to take the next steps or not and be able to keep those scores. I also wanted to point out that you could do one track first and then immediately jump into the next track. And even if you did that, you would still have a good 8 months to decide if you wanted to move forward with accreditation. And that would be all the time that you could use to be developing documentation and moving the work forward. So just wanted to point that out, that I also think that's another great advantage of Pathways. If you're not quite ready for accreditation and you want to get there, this is a great way to put your foot in and take that first step. And there's a lot of time built into the process for you to be ready for accreditation. I've mentioned the 2 tracks. Let's talk about that really quick, and then I'm going to stop talking and ask if there's any questions. So there's 2 tracks to Pathways. Track 1 gets to domains 1 through 7, and it covers those foundational capabilities that you see here. So assessment and surveillance, community partnership development, so on and so forth. There's 19 measures that are part of track 1. Track 2 is domains 8 through 10 around organizational competencies, accountability, and performance management. There's 15 measures there. Because equity is in every domain of the standards and measures, equity is also in both tracks of Pathways. I know 19 measures and 15 measures sounds like it's maybe not exactly even, but when you look at the sub-requirements and the documentation that's necessary to meet the different tracks, they really are pretty equal, whether you choose to do track 1 or track 2, kind of workload-wise. Before I keep going, I'm going to stop. Haven't seen anything come in the chat. If you have a question, please let us know. I'm going to give it 30 seconds. Okay, hearing none. Let's keep going. So we really consider this a choose your own adventure. So what we tell health departments when they're with us for readiness and training, which is the first step of the process, is that once they have the result of their readiness assessment and they decide what they want to do going forward, they have a lot of different options. So it could be that a department would complete Pathways Track 1 and then apply for accreditation. Maybe you do Track 1 and then Track 2, and then you apply for accreditation. Maybe you only do Track 2 and then apply for accreditation. There are lots of different ways that you can work the system to give yourself time to do the work that you want to do to become accredited. So it really gets to time frames and your readiness. We also have in here that you can apply directly for accreditation coming out of readiness and training or other. Maybe you decide that you're not quite ready for your next steps. And so you take those results of your readiness assessment and apply them to your department. And then when you're ready, you come back and we start that process again. So we tried to build a lot of flexibility into this process. So here's the flow chart, right? You gotta love a flow chart for the pathways process. So it starts with preparation. So in that preparation phase, you're gonna attend required training. There's a 4-hour training, a virtual training just like this, that everyone, that the accreditation coordinator for each department has to attend, and we encourage other folks to attend with them. You submit a readiness assessment. The readiness assessment is a self-assessment of your ability to meet the standards and measures, and you provide questions to PHAB throughout that, and then we provide you a report back, which we're going to talk about more in a little bit. From that report, you're going to review feedback from PHAB. We make a recommendation about whether we think Pathways Track 1 or Track 2 might be better, or initial accreditation. You can take our recommendation or leave it. It's just a recommendation. But say you decide to submit your application for Pathways, and it works the same whether you go for Track 1, Track 2, or both tracks at the same time. So the first thing that's going to be happening is you're going to be assigned a cohort. We have different time frames with Pathways where we have different groups of departments go through together. And we're going to talk about that a little bit more here in just another slide. Then you have 6 months once your cohort begins for documentation selection and submission. And in that time, and probably the time before, you'll be preparing the documentation and submitting it in PHAB. Then there's a review process. So PHAB accreditation specialist, as well as at least one peer reviewer, look at your documentation and provide a report about what meets and what doesn't meet standards and measures. And then there's a recognition decision. This decision is made by PHAB's CEO. It's not made by the accreditation committee. And a department can either be acknowledged for completion of one track or recognized for completion of both tracks. We're going to talk about each of these steps in more detail. What I want you to notice though here is that this is a point in time kind of distinction. So there's no annual report, there's no kind of ongoing work that you would do back and forth with PHAB. Once that decision is made, that's the decision, and you can choose to go forward with initial accreditation, another track, or stop where you're at. The readiness assessment result. So the readiness assessment is a pretty long document that you get back. So you get back all the information that you provided to PHAB, as well as all of our responses. And we give you kind of a percentage score of readiness. So you can see here that we provide it by domain, as well as by foundational capability. So that foundational capability measure is especially important with Pathways, if you want to look at Pathways. So there you'd be able to look at which foundational capability areas you were stronger in, which ones you might want to work more in, and that could help you decide if you wanted to do track 1 or track 2 of Pathways. We've had some departments say, I'm really strong in this area, so I want to go ahead with that area right now, and then I'll get to this tougher stuff later. We've also had departments do the exact opposite, who say, I want to come in, do the stuff that I don't have right now through Pathways, and know that I am going to have smoother sailing once I get through this section. So that report comes back to the department along with, like I said earlier, a recommendation for Pathways Track 1, Track 2, both tracks, or initial accreditation. It is not binding. I want to say that again, not binding. It's up to you what to do next as a department. These are the different cohorts of pathways. This, I feel like, is a really cool benefit of pathways that's not part of anything else that PHAB does. So with pathways, there's a learning cohort. So everyone who's going through pathways at the same time has the chance to meet together for sometimes 5 times with PHAB staff to talk about how things are going, get a little bit of training, and a lot of times there's a lot of just support for each other. What we do is we hold applications until these 3 points of the year, and then we start a new cohort. So with anyone who applied from the end of June to the end of November, that group starts the 1st of December, right? And so we move cohorts through this together. It's a nice way to have a community, and I really feel like the sharing of information has been beneficial. The kinds of things that we talk about in the learning community are in this next slide. So it may be diving back into the process steps and revisiting timelines. It could be that we talk about ways that you can build your team, things that you can do to make it fun, to make this work fun, because we also know that that helps the work go a little bit smoother. We talk about communication. Who do you need to communicate to about what, right? Where are you at in the process? What do you need to be telling your partners, your governing entity? What do all staff need to know versus folks who are more involved in the team? We do spend a lot of time talking about interpreting the standards and measures, right? If people have questions about what does this mean? What does it look like? We can talk through those things together. Documentation preparation, so giving you kind of tips and tricks about the best way to prepare your documentation to make it really easy for the site visitor to look at that documentation and make a decision about whether it meets or doesn't meet criteria. We talk about how to use PHAB, which is our electronic documentation system, and a whole lot more. So in these meetings, we're really trying to build community, have folks work together, problem solve together, learn from each other. And I've had a lot of fun in the meetings that I have been a part of. I feel like there's some good laughter and sharing and just a genuine kind of help for each other. So the documentation preparation and submission phase, you're going to be doing that at the same time you're going through that training with the cohort. So this is a 6-month time frame. In that 6 months, you're going to be preparing your documentation forms, preparing documentation, and submitting an PHAB. I have 2 pictures here I want to talk to you about. So on the right, the PHAB Pathways Recognition Track 2 documentation form. So for each measure and each example, there's a documentation form that a department has to fill out. And this explains to the reviewer where in the document that measure is met, how we describe it. And so that's a really great way for you to provide context and to tell the site visitor exactly where you want them to look. The screenshot there on the left is PHAB. So you can see that you upload those documents in PHAB. And that's the documentation system that our reviewers are looking in to provide that feedback. As we review the documentation, we score it in this way. It's either fully demonstrated, which means that everything is there, every bit of the requirement. If it's largely demonstrated, that means that most of the requirements are met. If it's slightly demonstrated, that means that some of the requirements are met. And if it's not demonstrated, that means that we can't find anything that gets to that intention of that measure. So everything is scored with those 4 scores. If there are things that are slightly demonstrated or not demonstrated, especially after that initial review, PHAB is going to identify that they would like additional documentation in those areas. They'll send you a list of those measures that they want further documentation, and you'll have 90 days to upload that additional information. And that would include completing the documentation form, marking up the documentation to show where you want folks to look, and again, providing an PHAB. So that's another part of the process, another 90 days of the process. But the other thing about that that's nice is you have a second chance, right? If you somehow missed the mark or they don't understand something that you thought was really clear, you have the opportunity to provide additional information within this process. So it's not a one and done kind of thing, which is nice. Oops, I need to go back. After the review process, there's going to be a report that's written about your department. That report is what goes to our CEO for them to make a decision about accreditation, or not accreditation, pathways recognition or acknowledgement. Any questions about any of that? You all are taking it very easy on me. Okay, moving on. So one of the things we want to encourage you to think about if you're thinking about pathways is to download PHAB's documentation tracking spreadsheet. So this is available to you right now in our Learning Center. To register for a Learning Center account, you can go to our website, register for Learning Center account, and then in the Learning Library, you'll find this course called Pathways Documentation Forms. And within that course is an Excel spreadsheet that you can download. And in that Excel spreadsheet, it breaks down each domain and each measure. It's a repeat of what's in the standards and measures as far as number of examples, data within, and it gives you a place to take notes about what you might have that meets the requirements of that measure. And it's a nice place just to keep those thoughts all in one place. What I hate to have happen is for conversations to be rehashed, right? Once I've had a conversation, I want to take good notes so I can go back to it and not have to have that conversation again. So we really hope that this Excel spreadsheet is a great way for you to take those notes. You are free to manipulate it in any way that you see fit, add columns, delete columns, make it work for you. But also wanted you to know you don't have to build this Excel spreadsheet for yourself. We have it out there for you. We have several resources for pathways that I wanted to talk you through as well. So these are available on our website. First, the standards and measures. So I feel like the standards and measures are the most important thing on this list. If you really want to understand what Pathways is asking of a department, you have to look at the standards and measures. Look at what they're about, look at what they require. And if you have any questions about what those mean or what the intent is, we're going to encourage you to reach out to PHAB and ask those questions. We want to answer them. We don't want you to be struggling to understand what it's asking for or what it means. We seriously, seriously welcome the questions. I can't say that enough. I know a lot of people say that, but we really, really mean it. So if you had any questions about the standards and measures, you should ask. I also recognize the standards and measures aren't like a quick drama-filled read. So it's sometimes best to just take them a domain at a time, a measure at a time. Ask yourself, what is this asking for? What does my department do in this area? And just to get familiar with them. The more you can get familiar with them, the more you can incorporate them into practice as best practice, and they can be a resource for your department moving forward. The next document I want to talk to you about is the policy document. So the policy document outlines kind of the nitty-gritty of the pathways process. It's everything you need to know, kind of line by line. What are the different steps of the process? What does an extension look like? What does the decision look like? The scoring look like? Some of the things that we've talked about. But it's all there in detail for you. I don't feel like if you're going to read something first, I would encourage you to read the standards and measures first, and then get to the policy document a little bit later. Those standards and measures, I still think, are primary to really understanding the Pathways program. We also have a scope of authority. So PHAB has a scope of authority of areas that we take accreditation documentation, and that includes pathways as well. Our scope of authority has changed a lot in the last few years. The policy changed during the pandemic and it got missed, I feel like, by a lot of folks, understandably. And so we're constantly having folks kind of ask questions and saying, oh, wait, we have new information about that. The scope of authority contains some examples of what's in scope and out of scope for PHAB at the back of the document. That's my favorite part of the document. It makes it really clear what you could submit and what you couldn't submit. And so as you're thinking about what do I have that shows how I meet these pathways measures, scope of authority is a good thing just to keep in mind. If for some reason you have a question about, is this in PHAB's authority? Again, we would welcome that question. Next, we have a PHAB glossary. The glossary has acronyms and terms that need to be defined. I had some folks in the department where I worked that wanted to know, what do they mean by policy, right? What do they mean by protocol? They wanted the exact definition. And so that glossary provides those definitions of those words so you can share them with folks. You're always welcome to ask, but you can look in the glossary as well. I usually carried a glossary around with me, so I was ready to answer those questions. We also have an idea glossary, so inclusion, diversity, equity, and anti-racism glossary. There are a lot of terms around equity in version 2022, and we heard from the field that some definitions of some of those terms would be really helpful. So the idea glossary gets to that request. Next, we have the Pathways FAQ, so the frequently asked questions just about pathways. This document is pretty extensive and it changes. So there are questions and answers about the general process towards the front, and then there are questions and answers around specific measures. So how we develop this list is really based on the questions that we get from the field. So if you ask us a question, there's a great chance that it might end up in the Pathways FAQ for other departments. We want to be really careful to answer questions consistently so that everyone gets the same information. And so in that way, we're consistently adding to the FAQ document to make sure that we're including the questions that we've asked. So I'd encourage you to take a look at that. Right now, I think it's like 16 pages. So again, it's not a quick read, but there's a lot of information in there if you have a specific question. We also have the documentation forms available in that same course as the spreadsheet. The documentation forms are those forms that you fill out that would go with documentation if you were to move towards pathways. They can also be a great place to take notes about what your department has or doesn't have. It's not as concise as the Excel spreadsheet, but if you're more of a Word person or a Google person, that can be a great way to work. PHAB also has our Learning Center and training. So with the Learning Center, we have information that's available for just-in-time learning in that learning library that you're able to access. If you decide to move forward with pathways, there are additional documents and resources that we would get you as part of your Learning Center account. We also provide training, virtual training like this, about a variety of things. So the first thing I want to mention is that we provide what we call new accreditation coordinator training. And this training is available to anyone who's curious about the position, but we also get lots of folks who are just curious about accreditation in general. And we would love to have you in new accreditation coordinator training. Those classes do fill up really fast. And so we're always trying to make more available, but it's a great way to meet some other folks. And we cover a wide variety of material related to the role, PHAB processes, how to read the standards and measures. And so if you're curious about PHAB at all, we would love to have you there. That training is available to anyone who's interested. If your department moves forward with pathways or initial accreditation, there's additional training that you're eligible for. One of the ones we do is related to documentation. And so we spend some time looking at the best way to mark up your documentation and present your documentation for it to go through the site visit process as smoothly as possible. And we talk about the ways to make it really obvious. So that's an option. And then finally, the Ask PHAB email address. So this email address gets you to our accreditation specialist team. And they are the folks who answer the questions about the process, about the intent of the standards and measures, and really, oh my gosh, they answer a broad variety of questions and want to answer your questions. We do this different training with an accreditation specialist, and she always says, "I'm not a mind reader, right? I can't know what your questions are if you don't ask me." And so we really would encourage you to reach out to that Ask PHAB email and ask questions if you have them. These are all resources that are available to you for the most part today, and you could get additional information about pathways. And that was my formal comments around pathways. And I'm ready if anyone has questions. Otherwise, we'll be done a little early. Not that that's bad. If you have a question, I would love for you to put it in the chat. And we'll kind of hang tight here for a bit.
We did get a question in the chat. So it
All
says
right.
organizations register for one Learning Center account or individual. I think we recommend individual accounts. Yeah, that way everyone has access to the entire learning library and they can kind of go at their own individual pace. And there isn't a limit on the number of Learning Center accounts that one department or organization can have. So we encourage every person to register, sign up.
And if you have any problems finding things in Learning Center, Amanda and I are the folks in charge of Learning Center and would be happy to help you find those courses. Thanks for the question.
I'll put our education services email in the chat so you have it handy if you need it.
Awesome. Okay, so Carrie, the timeline for moving through pathways and or initial accreditation available on the website. Yes. There are a couple different places. Amanda, there's that infographic about the 7 steps. That might be a good one to put the link in. The policies also include those timelines in detail. The FAQs, I think, for every product also include the timelines. And we have information in the Learning Center in a course kind of generally about PHAB and accreditation that starts to talk about some of those timeframes as well. If there's any I can clarify for you today, let me know. Thank you for your question. Oh, the Gantt chart. The Gantt chart is not on the website, but it will be in the slides that you get with the presentation. If you want it in a different format, let us know. It's an Excel document that I'd be happy to share with you. A copy of the presentation. So this week you will get a recording of the presentation and the slides in your inbox. We'll have those to you within the week. I get it, Carrie. Lots of timeline questions. You're welcome. Other questions? Well, ponder it. I just want to say a couple more things. We really hope that more people give pathways a shot. Right now we have 7 departments pursuing pathways. We have the 1 recognized, and we're kind of open for more departments in that November cohort. We really think that pathways is a good way to kind of put your foot in the door, see how this process works for your department, see how your staff react to the process, the standards and measures, just get a better feel and more comfortable with the standards and measures. That learning cohort aspect is really nice because you're not having to find people to talk to about this. You have people kind of built into the process. And if you are in a state or location where you don't have a strong cohort of departments going through the process or a learning community, the Pathways community really provides that in a great way for departments. I would also say that we have smaller health departments and Pathways as well as medium-sized health departments. And I really hope if you're curious that you give it a chance. Anybody else? You're welcome. All right. Well, I'm not going to keep you here unnecessarily. Thank you so much for your time. We put a link to the evaluation in the chat. We'll also send that to you in the follow-up email. We would love to know what you thought of today's webinar, how we can improve it. We take our quality improvement pretty seriously and want to be sure that what we're providing meets the needs of folks out there. So please let us know in the evaluation how we can serve you better through webinars like this. And like Amanda just said, all the resources shown in the presentation are going to be linked so you can get them on the email address. If anyone wants those Gantt charts, let us know and we can provide you with that Excel file. Okay. All right. Thank you, everyone. I hope the rest of your day goes well. And I hope to see you at another FAB training sometime soon. Thank you, everybody.
Thanks, everyone.